Hi friends, I am Dr. Dattaram. I am a surgical gastroenterologist and a HPB surgeon at KIMS Hospital, Gachibowli, Hyderabad. Today I am going to talk about a common anal condition called anal fistula. Anal fistula is nothing but a communication between the inside of the anus and the skin around the anus. The anal canal is about 3.5 to 4 centimeters in length and it is surrounded by two rings of muscle, one inside the other. The inner muscle is called as the internal anal sphincter and the external muscle is called as the external anal sphincter. So these sphincters help to control the anal canal. The most important reason why a continence of the anal canal is maintained. So there are glands lying in between these two muscle sphincters which open into the anal canal. Whenever these glands get infected, infection spreads in all directions and forms a fistula. Fistula is a communication between the inside of the anus and the skin around the anus by a tract called a fistulous tract. So essentially a fistula forms because of infection of the glands around the anal canal. A fistula is just a infectious problem. It's a problem due to infection by bacteria. So the common symptoms are these patients present with painful swelling around the anal region, which opens up to discharge pus. So pain and discharge. So pain associated with pus or blood stained fluid discharge are the most common symptoms. So what happens whenever there is infection and pus formation in this tract? It just opens out to the exterior and there is discharge of pus. So once the pus gets discharged, the fistula heals off. So this process of infection breaking open keeps on repeating. That's called as recurrent pain and discharge. This is a classic symptom a patient with fistula presents with. Sometimes this may get complicated by formation of a large abscess or extension into unusual areas like supralevator extension and horseshoe communication with the opposite side, and a simple fistula can become a complex fistula. How are these fistulas classified? So fistulas are classified either as high or low, or depending on the position of the tract with respect to the sphincters or the muscles around the anal canal. So fistulas are generally classified like intersphincteric fistulas or transsphincteric fistulas or extra sphincteric or suprasphincteric fistulas. This is the commonest classification what clinicians use to classify a fistula.